Hello, I'm Simon Whistler, you're watching the Today I Found Out YouTube channel, and in the video today we're looking at how Pilates caused a woman's body to swallow one of her breasts. And make sure that you stay tuned to the end of this episode for some bonus facts. Imagine there you are trying to stay in shape, going to your local Pilates class, and while performing what is known as a Valsalva maneuver, your body suddenly swallows one of your breasts. As fate would have it though, we don't need to just imagine. You can ask a 59-year-old from Maryland who had that very thing happen. So what set of strange circumstances led to this breast being swallowed? In 2011, the 59-year-old in question went to Johns Hopkins Medical Center and spoke with Dr. Tiffany Fong in the emergency room. Dr. Fong stated, "I remember her saying, 'My body swallowed my boob.'" Like any good emergency room physician, Dr. Fong took a general look at her medical history to find out how this seemingly impossible thing could have happened. It turns out the woman recently had breast reconstruction surgery after having a double mastectomy as a result of breast cancer. If that wasn't bad enough, shortly thereafter she also needed to have one of her heart valves replaced. The doctors performing that surgery chose to use the same entry point used in her breast reconstruction. They needed to also make a small incision between her ribs, intercostal space, to allow access to her heart. Fast forward 3 months to post-heart valve surgery. For reference, 4 to 6 weeks is the standard recommended recovery time before working out, and so Pilates was on the menu. So how did the Valsalva maneuver cause her body to eat her boob? The maneuver is one that involves trying to forcefully exhale while you simultaneously close your mouth and pinch your nose. This creates very high intrathoracic chest pressure. That pressure caused the small incision between her ribs to open up. When she finished her maneuver, her synthetic bosom fell into the space between her lungs. As if losing her breast to a hungry chest wasn't enough, when she performed the maneuver again, part of her lung protruded out of the same small incision. Despite the lung hernia, she had no complaints of pain or trouble breathing. The story does have a happy ending though, in that the doctors were able to replace the swallowed breast and seal her troublesome incision with wire mesh. And now for those bonus facts. According to the American Society of Plastic Surgeons, there were 286,274 breast implants performed in 2012 in the United States. It was the most performed plastic surgery procedure that year. Number 2 was nose reshaping. It came in with 242,684 total procedures. On the latter, this was down about 14,000 nose procedures from the numbers in 2009. Presumably, the death of Michael Jackson that year explains the drop-off. Right, and now for another bonus fact. The average cost for a breast implant will vary depending on the type of procedure and the doctor that performs it, but it normally ranges from between $5,000 to $10,000. Every now and then, you can really find a 2-for-1 deal though. And another bonus fact, there are 2 main types of breast implants, saline and silicone. Silicone gained notoriety in the US over concerns of the potential health problems should they leak. In 1992, the FDA banned their sales. In 2006, they changed their minds after more research had been done. That's good news for both ladies and men alike. As some people have said, silicone implants feel more like real breasts compared to their saltwater counterparts. So I really hope you found that video interesting. If you did, please do give us a thumbs up below and don't forget to subscribe if you haven't already. Also, over there on the right, a couple of other videos you might enjoy if you enjoyed this one, and thank you for watching.